Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Zinc is required in many ways for your immune system, especially to fight viruses. One of these ways that zinc is required is to create T cells. You've probably heard with the COVID-19 that we have some T cell immunity. There's memory T cells that if you get COVID-19 and you were exposed to one of the coronavirus type colds, you might have holdover T cells that have some ability to fight off COVID-19 and help prevent it from becoming dangerous, because this virus on its own can become quite dangerous. In a study of people with HIV, when they gave them zinc, it improved the formation of CD4 plus T cells. Now that would reverse the failure of the immune system by about 76% in that study. And also they found that elderly people and people in nursing homes, they're commonly low in zinc. Zinc becomes increasingly more difficult to absorb as you grow older. They're commonly low in zinc, and this sets them up for developing not just a viral infection, but viral pneumonia. So a randomized placebo-controlled study in people over the age of 65 found that if they gave them 25 milligrams of a zinc supplement every day for 3 months, it increased the concentration of helper T cells and cytotoxic T cells in their blood pretty dramatically. Now these are virus killers. These track down viruses and they kill viruses. Another trial shows that nursing home residents who received 30 milligrams of zinc a day had improved levels of circulating T cells. In the same study, a lower dose of 5 milligrams had no effect. And they found out that if they gave them 30 milligrams and they could raise their blood level of zinc to normal, they had a much lower risk of developing serious viral infections. So welcome to our episode, COVID-19 and Zinc, New Findings. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the Senior Scientific Officer over here at Invite Health. So let's look at some of these findings. There was a review recently in the International Journal of Molecular Medicine, and it focused on the benefits of zinc and specifically COVID-19. And they found that zinc probably has a protective effect. It could have a protective effect against COVID-19 by supporting the parts of the immune system that fight viruses, but also reduce inflammation. Now that's an important statement. With COVID-19, the virus can get into major organs like the heart and the lungs. It seems to get all over the body, the kidneys, and it triggers inflammation. And then there's a backlash by the immune system. We call it cytokine storm. There are chemical messengers from the immune system called cytokines and chemokines, and if they're released at too high in abundance, they trigger severe inflammation. And they're finding that a specific one is at the core of that, interleukin 6. It causes a great deal of inflammation. And they're finding that in people who develop COVID-19 pneumonia, there's a surge of interleukin 6, a cytokine by our immune system that further inflames the lungs, and people wind up with acute respiratory distress syndrome where the lining of the lungs can flood with fluid, and then they're in trouble. Then they're in the intensive care unit, and then they might be on oxygen or they might be intubated for oxygen, and they have a higher risk of dying. So researchers from many places, from Germany, Greece, Norway, Russia, the US, worked with a Dr. Skolny, and he put together this scientific evidence on zinc's role. So they reviewed studies on zinc's role in preventing and treating respiratory tract infections, but also COVID-19. And here's what they found. The review, specific evidence that zinc can fight off coronaviruses. One study showed that zinc blocks the enzyme or an enzyme responsible for replicating the coronavirus that led to the SARS outbreak of 2002. They also found that zinc supports the production and maturation of white blood cells. These are the major players in the immune system that help fight off cancer and viruses and bacteria, etc. Zinc also helps to regulate inflammation. So that helps prevent that cytokine storm. And they said zinc has an anti-inflammatory effect in pneumonia, limiting the amount of damage to lung tissue. Now, we've known for decades that zinc is important for the immune system. They found that higher levels of zinc in your cells helps block the reproduction of rhinoviruses. These are cold viruses. But it also stimulates interferon alpha production. That's really important. The immune cells, when they're rushing in to fight a virus, like the neutrophils, there's a trigger of a release of chemical messengers by the immune system called interferons, which have multiple benefits, multiple activities. One, the interferons cause the multiplication of immune cells, because if there's millions of virus cells, you need millions of immune cells, and they're not necessarily available. So the interferons trigger the multiplication of immune cells very rapidly, but also later on in the infection, it prevents that backlash by the immune system that could destroy people's lungs. So these are very important findings, and once again, it's in the International Journal of Molecular Medicine. So many human clinical trials, just to give you some background on zinc, in young people, in the elderly, and people with chronic diseases, zinc is needed for your immune system. Taking a bit extra during cough and cold season is very helpful. It reduces the duration of symptoms, like if you get a cold or an upper respiratory tract infection. It protects you from the infection in the first place. You're less likely to develop an infection. Now, there was a review of studies published in the journal BMC Family Practice. They're looking at zinc lozenges here. And they're looking specifically at viral infections that affect the upper respiratory tract, your throat, your nose, etc. Zinc reduced the length of suffering with a cough by 46%, a sore throat by 33%, a stuffed nose by 37%, a runny nose by 34%, and something that's less common when you get an infection, muscle soreness by 54%. Now, the thing with a cold with zinc helps reduce the duration of a cold infection, and it makes the infection much milder, and it may block the infection in the first place, because zinc helps block enzymes that viruses release to infect us, kind of like a Teflon coating for the immune system, really, that you had to take the zinc right away, and you had to take enough of it. It makes a big argument for taking zinc on a daily basis, especially during cough and cold season. So it's just smart to take zinc on a daily basis. Zinc's needed to make the cells that kill infections. Like the first cells that get to the infection are called neutrophils, but also macrophages. They single out the viruses, and they attack the viruses and kill them. But also the cells that control your immune system that come around later on to fight an infection. A very specific part of the immune system called acquired immunity, where they're specific for the virus and they kill the virus. So that would be your B cells. These are where your antibodies are that recognize specific viruses and bacteria. But also your incredibly important T cells. They guide the immune system, they kill infections, but they also have the job of turning off the immune system once the infection is finished. So zinc is also required for your natural killer cells. These are important cells. Older people have plenty of natural killer cells. They don't work well. Zinc improves their function. Natural killer cells are the bridge between the earliest parts of the immune system and later on in the immune system, like 5 or 6 days after encountering an infection, when you're developing memory T cells and antibodies. You need the natural killer cells to bridge that gap in there. Otherwise, infections can become quite dangerous. And you need zinc to create natural killer cells. So viruses use proteins on the outside of their viral envelope to infect us. They have to attach to our tissues, they have to invade the tissues, they have to multiply, and then spread from cell to cell. Zinc has the ability to complex with these proteins. The proteins are released by the viruses, and the more zinc you have in your cells, the better it works. This reduces the ability of the virus to infect you in the first place. So a deficiency of zinc increases the dysfunction of the immune system, but it also increases your susceptibility to infections. Let's go to a break. Jerry Hickey, Invite Health. I'll be right back.
Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Okay, welcome back. Jerry Hickey. We're talking about new findings on zinc for the COVID-19 infection, viruses in general. So, who is likely to be low in zinc? Not necessarily deficient, but just low. Older adults, people over the age of 60. Why? It gets harder for some reason that we don't quite know why for older people to absorb zinc from food. And this is not unique to zinc. It's also lutein, which is needed for your vision and your brain. There's a number of nutrients that become harder to absorb from food as you grow older. So zinc is one of them. But also it's not unusual for children and adolescents to be low in zinc because of the food they eat. But there's a lot of drugs that take zinc out of the body. ACE inhibitors. They're used for high blood pressure. They're used for heart failure. Drugs like lisinopril, which is Prenivil. But also diuretics like hydrochlorothiazide and Lasix, which is furosemide. Estrogen replacement therapy lowers your zinc. Proton pump inhibitors, they use those for GERD, the chronic heartburn. And H2 inhibitors, they're similar, they're a little bit weaker than proton pump inhibitors. A good example of a proton pump inhibitor would be omeprazole. An example of H2 inhibitors would be cimetidine. These block the absorption of zinc from your food. Steroids such as prednisone, you lose zinc in your urine. Laxatives, antacids, even aspirin can lower your level of zinc. Vegans and vegetarians. There's a lot of things in the foods that vegans and vegetarians base their diet on, such as grains and legumes, such as phytates that block the absorption of zinc. So the need for zinc might be much higher in these people. Pregnant and lactating women have a higher need for zinc. People with severe or persistent diarrhea, people with malabsorption syndromes such as the one with wheat, gluten, like celiac disease or short bowel syndrome, people with Crohn's disease and inflammatory bowel diseases like ulcerative colitis. Alcoholics, or people who drink a lot of alcohol or drink it frequently, they lose zinc in their urine. People with chronic kidney disease, people with sickle cell disease. And for the elderly and people with HIV, zinc supplementation is really a must. So let's look at some more of the data. Zinc is fairly commonly low in elderly people. There's just a drop in zinc that accompanies the decline in immune function. In a study of nursing home residents, a low level of zinc in their blood serum, that's the red part of the blood, a higher rate of pneumonia, but also, sadly, pneumonia-related mortality. In fact, it increased all-cause mortality, which would be dying from any cause. Now, when they look at middle-aged and elderly adults, you give zinc, it improves their immune system function. There's good evidence for that. In a placebo-controlled study in people over 65, if they gave them a zinc supplementation 25 milligrams a day, over 3 months it increased their level of T cells, like helper T cells that show the immune system what to attack, and cytotoxic T cells that kill the virus. There's a number of studies showing this. When they gave elderly people in institutions 5 milligrams of zinc, it did nothing for them over cold and flu season. But if they gave them 30 milligrams and it was enough to restore their blood zinc levels to normal, they did much better with infections. They were much less likely to develop pneumonia and other infections. So can zinc help with COVID-19 directly? Well, these are researchers from Spain that they recently reported at the European Coronavirus Conference. Hospitalized COVID-19 patients, coronavirus patients with low blood zinc levels, they did far worse than those with higher levels of zinc in their blood. So here's what they said. This is from Hospital del Mar in Barcelona. It's a Dr. Roberto Guerra Fernandez. Low zinc levels at admission to our hospital correlated with greater inflammation in the course of infection and poorer outcome. Poorer outcome could mean terrible things. So in a new study, his team tracked outcomes against the results of lab tests on 250 patients admitted to their hospital with COVID-19. The patients averaged 63 years of age. 8% of them died from the illness. All of the patients had their blood zinc level tested upon admission to the hospital. Among those who died of COVID-19, the zinc level of the blood was much lower, averaging 43 micrograms per deciliter. 43, that's the number. In contrast, the blood levels among the patients who survived, now this is out of 250 patients, averaged 63. So patients with low levels of zinc were much more likely to die or do poorly. Also, higher levels of zinc in the blood were tied to lower levels of inflammation-causing cytokines, the things that trigger that severe reaction in the lungs, where the lungs flood with fluid and you can't breathe and you wind up in the ICU. Now, they adjusted for factors such as age and gender and illness severity and the treatments they received. Every unit increase of zinc in the blood, so in other words, if it went from 62 to 63 or from 63 to 64, was tied to a 7% lower odds of dying while in the hospital. So if your blood level went from 50 to 54, your risk of dying in the hospital dropped 21%. And they were saying that the elderly people admitted to the hospital with a blood level of 63 had a much lower risk of dying than the people admitted to the hospital with a blood zinc level of 43. So here's something very recent, November 2020, from the International Journal of Infectious Diseases. And they state right at the start of the study, zinc is a trace element with potent immunoregulatory and antiviral properties and is utilized in the treatment of coronavirus disease 2019, COVID-19. So here's what they said. COVID-19 patients showed significantly lower zinc levels when compared to healthy people in their study. They called them controls, the people who had good levels of zinc, amongst who were not admitted to the hospitals. Amongst the COVID-19 patients were found to be zinc deficient, 58% of them. 58% of them were zinc deficient. Not just low in zinc, but actually zinc deficient. So in the COVID-19 patients, zinc deficiency was very common, just like low levels of vitamin D is very common. These patients were found to have higher rates of complications. So if the zinc was low, you had a much higher risk of acute respiratory distress syndrome, where the lungs flood with fluids and you can't breathe and you wind up in the ICU or worse, needing corticosteroids, dexamethasone therapy, staying longer in the hospital, and a big increased rate of mortality. The odds ratio in a zinc deficient patient for developing complications was 554% higher, and a much higher rate of mortality. So here's a simple way to do it. 30 milligrams of zinc a day should be enough for a healthy person for their immune system to function well. If you're diabetic, take a higher amount, because diabetics lose zinc in their urine. They lose zinc and they lose magnesium, and their vitamin D doesn't work well and their vitamin C doesn't work well. So there's a lot of strikes against diabetics for having poor immune function. I told diabetics to get zinc 30 milligrams twice a day, because not only does it help their immune system function, but zinc is needed by the pancreas to control your blood sugar. Always take your zinc with food. So thank you for tuning into our podcast, the Invite Health Podcast. You can find all of our episodes. You go right to our landing page. You open up our website, invitehealth.com, And if you scroll down, there's a big icon for the podcast, and there's well over 200 at this point. But any place you listen to your podcast, like iHeart, wherever you listen, please subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. I hope to see you on another episode of the Invite Health podcast. Thank you for listening. Thank you so much.